Alpha glucosidase inhibitor, AGIs, are what are we going to discuss about. These are a class of oral antibiotic medicines. Those are used primarily to manage abdominal blood glucose levels with type 2 diabetes. There are acarbose, a widely used AGI, Miglitor, and Volivos. These drugs slow down carbohydrate digestion and absorption. Therefore, blood sugar levels rise slowly after meals. So they help to prevent rapid spikes. AGI acts as a competitive and non-competitive inhibitors to certain enzymes, alpha amylase in the pancreas and alpha glucosidase in the small intestine. These digesting enzymes play crucial roles in breaking down complex carbohydrate like starch. Alpha amylase break down starch into much more small molecules, maltose, maltotriose, and dextrin. And alpha glucosidase, which acts in the small intestine, makes oligosaccharide and tri or disaccharides into monoforms like glucose. These broke down carbohydrates are good for absorption. By inhibiting these enzymes, AGI slowed the breakdown of complex carbohydrate, leading to a more gradual rise in blood glucose levels post-meal. Delayed glucose absorption benefits overall glycemic control when used alongside other diabetic meds or dietary interventions. Then, where do we find alpha glucosidase inhibitors? Do we have to rely on the market or pharmacies? Not necessarily. AGIs can also be found naturally in certain foods. These foods not only mimic the action of medication, but also have slow carbohydrate digestion and absorption, supporting healthy blood sugar levels. Bitter melon, despite its name, is not sweet and has a distinct bitter taste. A cup of bitter melon, cooked or fermented, can interfere with the absorption of monosaccharides in the gut. This unique fruit is a powerful addition to an anti-diabetic diet due to its bioactive compound, particularly carotene, which play a significant role in blood sugar management. In a study conducted on rats, a bitter melon diet influenced blood glucose and SOD levels. The groups given bitter melon, both fresh and fermented, showed significantly reduced fasting and postprandial blood glucose levels compared to the control group. However, the reductions were not as pronounced as those in the group treated with acarbose, a pharmaceutical alpha-glucosidase inhibitors. Interestingly, fermented bitter melon was found to be more effective than fresh melon in lowering blood glucose. Additionally, bitter melon contains phenolic compounds such as 5-HMF, which demonstrates strong AGI activity. Remarkably, this study also showed that even heat-treated bitter melon retained its anti-hyperglycemic properties. This means that cooking or processing bitter melon does not diminish its ability to lower blood sugar levels, making it a versatile ingredient for managing diabetes naturally. Berries such as blueberries and blackcurrant contain phenolic compounds that inhibit alpha amylase and alpha glucosidase enzymes. These phenolics, through hydrogen bonding, bind to the active site of the enzyme, reducing the space available for sugars to bind. These mechanisms act as a competitive and mixed type inhibition. In studies, groups treated with extract of oat bran, blueberry, and blackcurrant powder showed increased alpha amylase and alpha glucosidase inhibitory activities. The magic lies in anthocyanidin, a type of phenolic compound. These findings suggest that blueberry and blackcurrant might be potential sources of anti-diabetic activity. Various fruit byproducts are rich in polyphenolic compound, antioxidant, and AGI inhibitors. Among these, mango pears have shown the highest anti-diabetic activity. Other beneficial pears include those from lychee, banana, jackfruit, pineapple, and papaya. It is well known that fruit pears often contain more beneficial compounds than the flesh. While eating them raw may be difficult, Cooking or preparing clean, organic fruit peels can make them easier to consume and provide these healthy benefits. Cinnamon is a standout herb with remarkable AGI properties. All types of cinnamon exhibit activity similar to acarbose, a pharmaceutical AGI. Taking a single dose of raw cinnamon before a meal can prevent after-meal hypoglycemia, particularly for those with type 2 diabetes. Cinnamon can be consumed as a powder, extract, or tea. Among the different varieties, Ceylon cinnamon stands out as the best overall option. While there are slightly differences between cinnamon types, most significantly reduce starch breakdown and possess anti-hyperglycemic properties. Other herbal teas are also effective. Some teas contain catechin, compounds that may inhibit AGI and help regulate blood sugar levels. Regular consumption of this tea may help prevent and managing type 2 diabetes. What are the possible side effects of AGIs? The most common issues are gastrointestinal troubles, including bloating, abdominal discomfort, and diarrhea. These occur because undigested carbohydrate, due to alpha-glucosidase inhibition, act as an osmotic agent. This means they draw water into the gut, potentially leading to diarrhea. In some cases, these drugs increase AST or ALT2. Fortunately, AGIs are not hypoglycemic agents. They do not stimulate insulin production or lower blood sugar below normal levels. However, consuming high amount of AGIs, either through food extracts or meds like acarbose or miglytor, can cause hypoglycemia in people with type 2 diabetes who are on additional medications. If you are a patient, it's important to follow your prescribed treatment and consult your doctor before making any changes.